So there are numerous dressings that can be used for wound care on the market today. And we're kind of going to go through them in categories. And if you have any questions about any of these, if you contact Stephanie can pass the questions on to me, if that's okay, Stephanie?
Sure, of course.
And then we can talk a little about more information. So if we move down to this end of the table, what you see here are antimicrobial dressings. And what they do is get rid of bacteria on the surface of the wound. So this product does that, as does this one and this one. These two products actually get rid of the bacteria in the dressing. So they need to be put on next to the wound, and they need to have something to hold it in place. So whether you use a Band-Aid, a simple dressing, or whether you use a cling wrap to hold them in place, it depends on where you are trying to put that dressing. And unfortunately, hidradenitis comes in very awkward to dress dressing places. Would you agree, Stephanie?
Completely agree.
Yes. So that's what using these kinds of products may not be ideal for you, but they do. I just opened this. These are some that are used. So this product is a chlorhexidine product. It has the chlorhexidine into this greasy background, and it's put directly on the wound. It is sticky, and you need to cover it with something. This is a silver product, and it's meant not to stick. You can see the shiny surfaces, and it will deliver some silver into the wound. This is a povidone iodine product. The most common thing that I think you would know is betadine, povidone iodine. It's used a lot on cuts and bruises and what have you. And it is in a mesh. The beauty of this dressing is that when it starts out orange, and when the fluid is coming out, the fluid is coming out of the wound, it causes the iodine to be released from the dressing, and the dressing will turn white, so that you know that all of the dressing has been used. And then this is called Polyhexamethylene Biquanite. It is a relative to this one in that it has just an extra molecule on it, but it takes the bacteria up into the dressing, and it destroys the bacteria in the dressing. This comes in every form of dressing material that you can think of. This happens to be a packing gauze. It comes in a roll gauze, a very wide roll gauze, and the name of that is Chlorhexidine. It is great. I just don't have any here, but it's great for putting underneath the breast or in the gluteal fold, and it tends to stay in place. And then there's a product called Sorbact, which again takes and destroys the bacteria within the dressing. All of these, like I said, need a secondary dressing on top of it. Back as far as cost is concerned, these two are very inexpensive. This is a 9.5 by 9.5 centimeter. It was a 9.5 by 9.5 centimeter, and it is in the neighborhood of about $1 a dressing, as is the AMD, the polyhexamethylene biquanite. The Bactigras runs in around the $3 to $5 mark. The Sorbact is in around the $10 mark, and the Silver Cell runs in between $5 and $10 if you purchase it.